Hey, good morning, everyone. Wanted to talk about a topic that Dr. Brett Zemba asked me about, and I figured I would just talk about this briefly for everyone. So, he was asking about when to put a lift inside someone's shoe. So, when to do a heel lift, full foot lift, and then I went a step further and said when to build up a shoe. So, now, first off, I don't have great diagrams to show you on this because I'm just doing a Facebook Live right here. Let's say first off, we're measuring on the X-ray the top of the femur heads, okay, to see if there's a leg length inequality. If there's a short right femur, short left femur, then we're watching how that drops the pelvis on that side. Then we're watching to see how the lumbar spine, or even up into the thoracic spine, deviates based on that leg length inequality. We're also looking at what's going on with the sacral base, because ultimately the lift is trying to level or get close to level the sacral base so that that can leave a level foundation for the spine, so that once you start to incorporate postural corrective exercise and traction and adjusting, then you can at least have a chance to improve that person's alignment so that they don't have a compensatory pseudo-scoliosis as a result of the leg length inequality. So now, without getting into all those details, because I don't have a diagram in front of me to show you, and it can get pretty convoluted if I just try to describe all of this stuff without actually looking at an X-ray. Basically, and there's a couple different ways to take X-rays on this. One is if you're taking a AP pelvic view and you have the central ray at the head of the femurs. That technically is the most accurate way to be able to see what's going on with the femurs. But if you want to see what's going on through the sacral base plane line, the most accurate way is taking a Ferguson view or a modified Ferguson view, where you drop the tube down, okay, typically to the level of the femur heads, and then you tube tilt up through the umbilicus. So what does that result in? Like, a 10, 15 degree cephalad tube tilt. What is that going to do? It's going to give you a good representation of the femur head leveling and the sacral, and you're going to start shooting through the plane line of the sacrum better, so that you're not looking at a sacrum at the wrong angle, and then you get a bad representation of what the sacral base is actually doing, to then take a measurement to figure out and then dictate to the patient what size heel lift they need to level the sacrum. Now, if you're shooting an X-ray back at 84 inches on an AP like we do, all the stuff I'm telling you right now, and I've compared them back and forth. I've compared our X-ray procedure versus taking a modified Ferguson versus taking a true Ferguson, which is dropping it super low and then matching the angle to that person's sacral base. That's a very weird looking X-ray if you ever taken a true Ferguson. And we get really good information off of our process of how we take an X-ray, and it serves all of our purposes, so we don't have to take additional views on the majority of the cases. Now, when someone has a really big increased sacral base angle, then taking a modified Ferguson is called for if you really want a true representation of what's happening at the sacral base. Okay, with all that said, let's just get into the lift thing. Let's say that you've determined someone has a leg length inequality of more than 6 millimeters. Typically 6 millimeters or more is where it becomes clinically significant that you're going to want to put some sort of lift intervention in there, especially looking at how it's affecting the spine. That's the key thing to look at. If they have a short leg and the sacrum is malformed and compensates the other way, and then the spine really doesn't deviate all that much on the AP, then there's not really a great argument as to why you're going to put a lift inside this person's shoe for the rest of their life. Okay, if there is a big convex curve, okay, so convex is the outside of my hand on, I can't even point to it because I'm holding my phone, but convex is not the inside, but the other side. If that convex side is on the side of the short leg or short sacrum, that's a pretty good indication that you're going to put a lift in, and you're going to start to decrease that, especially when you address postural corrective exercises and in some cases even traction. So, kind of the rules out there is, if it is a 6 millimeter lift that you put inside there, you could put that at the heel. How I normally instruct a patient how to do that in our little 1/4 inch 6 mm lifts is I say pull the insert up inside of your shoe, put this little heel lift down, and then flop your insert back over, or sorry, yeah, flop your insert back over it so you don't actually feel like you're standing on something. It kind of camouflages it so you don't feel it as much, it feels more comfortable. People get that. More than 6 mm in a standard size individual, someone that's like around 6 foot maximum height, more than 6 mm inside the shoe, you could go up to 12 mm. All right. Once you go over 6 mm of heel lift, it's a good idea to start raising the entire foot up and do a full foot lift. So, for example, if we do a 6 mm lift, we do a heel lift. If we do a 10 or a 12 mm lift, we're going to do about 6 mm in the heel, and then the remainder of it is going to be a full foot cork lift. We usually get our full foot cork lifts from Mojo Feet. We get our heel lifts usually from some orthotic company that I can't think of the name right now. There's also a really good resource on Amazon. You can buy Cork Coasters. They come in 1 mm strips. You can get 100 of these like 3-inch by 3-inch cork coasters that have adhesive on them on Amazon. If you just do a search for Cork Coasters, you'll find them. It's like $17 for 100 of these strips. We use those a lot for pediatric lifts, and we can cut them out with the scissors. It's just way more cost effective and easier. And if we have parents that have a bunch of kids, or even if they have a kid that's got a short leg like that, we might have them buy a lift from us to get them started, and then we just send them that link on Amazon and tell them to buy a bunch of those coasters, and they can make their own lifts that way. Okay, so again, just to recap, 6 mm or less, put it at the heel. 6 to 12 mm, typically you do a full foot lift. You build up some at the heel, some at the entire foot. We get the cork lifts from Mojo Feet. We build up with that little other adhesive heel lift on top of the cork lift. So we make this little hybrid combination. We try to fit that underneath someone's entire insert in their shoes, so they're still not standing on it directly. They swap it between shoes, or we make a couple of them for them. And then the third variable is when do you build up their shoe itself? That's when you exceed 12 mm. When you get more than 12 mm, now you run into the problem of having their heel start to bump out of their shoe if they don't have a very tall heel cup. Most people heel cup in their shoe is not tall enough to prevent that, so their heel starts to shift out of their shoe. That's where you go and have their shoe built up. There's a place here in town that does it. They charge about $40 for a shoe, and we tell the patient how much to get it built up. They take it over there, and basically what they do is they take the entire sole of the shoe, they strip that away from the shoe itself, they match the color of the material, they build up that material in a progressive like triangle. Okay, so it's thicker at the heel, and then it very, very, very slowly starts to get thinner towards the toe, and depending on how much thickness you're putting in there, they determine how much they taper it forward. So it's not like a sharp triangle or anything. It doesn't create like a big high heel on them. But when someone has like a 1-inch difference in leg length, which we've seen before, we send them out and they build up these shoes, and you really can't even tell if anything's in there unless you're trained to look at it. And then you see, wow, there's a lot of material in there in the shoe, because an inch is a lot. That's a big lift, but that happens sometimes. So anyway, over 12 mm, they'll build up the shoe. They split the sole from the shoe. They then glue that in there. They put it all back together again, make it look real nice. You can find a shoe place in your area that probably does this as well. You can establish a relationship so you have that resource for your patients. So in summary, that is some of the rundown of when to do a heel lift, a full foot lift, and build up a shoe in a leg length inequality issue when you're trying to level the sacrum to improve spinal alignment. Hope that helps. And side note, want more information about all the systems that we do and how we look at all of this stuff in a functional movement manner and a procedural manner in your clinic, watch our demo, demo.movenowyou.com. 30-minute demo, check it out, gives you a really good idea of all the systems we put together. There is nothing like this out there, I promise you. And I know, because I've bought and done a lot of different systems, and I always wanted to make sure that we over-delivered times 100, and we have. So check it out. Have a great day. Hope this is beneficial to you. Over and out.